pathetic, prostitute, useless. Tragedies happen because of the smallest things. Bullying, isolation, and negligence are some of them.
In Asia Pacific, HIV infection rates among young men who have sex with men is close to 4.2%. Globally, 19% of transgender women are now living with HIV. 95% of all new HIV infections of young people in Asia Pacific occur among the adolescent from key populations.
But why? What are the obstacles preventing young men who have sex with men and young transgender people accessing HIV health services? There are many reasons, like stigma and discrimination, low self-esteem, low self-confidence and self-acceptance, as well as financial dependence, lack of information, and family pressure. In the clinic, they often treat these young clients as mentally sick without respect and dignity, which makes clinics become unfriendly and lack of confidential places. These behaviors may result in harmful consequences, and because of negative attitudes about sex, HIV, and other obstacles towards men who have sex with men and transgender people, those will become the building blocks of the walls that confine and isolate young men who have sex with men and young transgender people from the services and their rights as young people.
What can we do to make these services friendlier and encouraging to young men who have sex with men and young transgender people? Let's begin with the crucial problems. Let's take down every single brick of the wall surrounding us.
Most of us don't consider HIV testing as an essential part of maintaining our sexual health because of stigma and experiences with discrimination.
Here's how service providers can be more sensitive to us.
For young clients like us, the availability of information about HIV testing, treatment, PrEP, and other health services should be easily accessible online and at various public locations, as well as available for young people below 18.
Other information regarding directions to the clinic, available services, and doctor profiles should be described with clear, simple language and visual aid. Young clients would then be informed enough to select services and providers that suit them. Methods for making appointments should be provided through phone, email, or in person.
Social media platforms like Facebook could also be utilized to reach, inform, and interact with us. Since visiting health centers can make a person feel anxious, we deserve friendly and welcoming services. That includes friendly and accepting attitudes, which makes it easier for us to be engaged.
The registration procedure should be made faster and simple and avoid insisting on our personal identification details to protect confidentiality. The entrance, lobby, private areas should be designed to be more inviting and have informative flyers about services and community-led events and groups. Clinics should encourage safe sex by providing free condoms and lubes. They should be privately accessed within the clinic premises. Getting tested and receiving results can cause anxiety. Counseling should be offered to young clients before and after testing to ensure our mental and emotional well-being. Post-test counseling sessions should be conducted by the same counselor that provided us the pre-testing counseling.
Testing may result in a reactive or non-reactive result. In case of non-reactive result, follow-up testing should be encouraged to ensure that we receive regular testing.
With the reactive case, confirmatory tests must be done before delivering the result. Our results should be disclosed discreetly and confidentially to protect our privacy.
And in the case of a reactive result, we should immediately have access to free and non-discriminatory treatment services. In both cases, we should be provided with other services such as referrals, support to coming out, disclosure, partner notification, hormonal treatment, and etc.
Living with HIV should not determine a person's value. Whether a young person is living with HIV or not, all young MSM and young transgender people should be able to take care of their health with the support of service providers. All young people should have the right to age-appropriate, stigma and discrimination-free HIV health services.